Hi, everyone. So this is Val again with Rant with a Purpose. Thanks for listening to our podcast. So today we have a very special guest. Her name is Cathy Hoth. Um, I've met her through some very interesting series of events, and proud to say she is one of the co-founders of KAFO, KAFO, the Concorona Alliance Foundation that I had mentioned previously in the previous episodes. Um, so Kathy is really here today, spending some time with us to talk um, about her background and just the very much beginnings, because we always want to see the great people, their great work, but we never really hear what they have accomplished before all these great work, how it was derived from. So, Kathy, if you don't mind just sharing some information on your background, what it was like, it could start from childhood if you like.
Wow. Okay. I am happy to start out that way. So I was born in the Booth Memorial Hospital for Unwed Mothers in Philadelphia. And so I knew from a very early age, it was discussed a lot, just how I was born. And I guess just I had some sense that I don't know, value to a person, and that it was a shameful thing to be born that way. And so I guess what that did to me was just try to figure out what my identity was. I spent a long time trying to figure out who I was and what my purpose was. And so I felt that there were things I could do to be helpful in the world. And so I guess, there was an underlying feeling of worthlessness. And then I fought against that by, I guess, demonstrating to myself that I had value. And so then what I did was volunteer and see how I could help other people. And so, as a child, then it started out with simple things, volunteering to help stray or hurt animals. And, I guess as I grew up, it morphed into different areas that I could help. And so, certainly once I became a parent, that was pretty impactful. It was incredible there's probably no greater way to help, I guess, in raising your children. And so then, but there were a lot of other things that then uh, surfaced at that point. I, tried working with Habitat for Humanity and in soup kitchens and in churches and children's programs. I became president of our local schools, home and school association. I volunteered in an orphanage. Uh, we did building projects, just helped everybody who said they needed it. We have a local organization that uh, helps with education, immigration, food insecurity, and homelessness. And so there are just so many opportunities around. But I guess as I was volunteering for all of those organizations, I was really aware of what was happening internationally too. And it seemed like there was an opportunity to have a greater impact. And so I guess just looking at what was happening in many other countries in the world, I recognized that there wasn't good access to education, especially for girls. And, just people didn't have very many of their basic needs met. Certainly homelessness is an issue, but it was really very basic, just no access to water, food insecurity, education, healthcare, jobs. And so it was even far worse than anything I'd ever seen in the US. And so I think the more I became aware of all of those needs outside the US, the more my attention shifted to really wanting to help where the needs were greatest in the world. And
Yeah.
so I guess initially I could help out there financially, right? There are so many international organizations that offer ways to contribute there. And so I did start out with wanting to help build schools in other countries. Education was really important to me, or wells. And I guess once I had become, I guess, more stable in terms
Hmm.
of, having my housing in reasonable condition, my children's education, accounted for, and everything. I really wanted to contribute significantly. To me, financially, I felt like I had more than I needed and just wanted to make sure to share that. And I but I guess when you start thinking about giving larger sums of money, then you really want to make sure that it's going to the right place. And
Hmm.
so many organizations, even if they say that they're spending 90 or 95% of their funding on programs, a lot of the programs then end up being managed by somebody who's making a fair amount of money. And so then very little of the money actually goes to the projects that you want to support, say building a school. So when I contacted organizations to say, I have, maybe several $1,000s I want to contribute, they would say, just go ahead and put it in our general fund and then we'll figure out how to allocate it. But my concern there was so much of it would go to the salaries of the people who were running the
Hmm.
organizations, and only a little would end up going to the people. And so many people just recommended that I not look to start a nonprofit, but just find one that's already in existence and support that. But it just the accountability that I was looking for, if I was going to really, sacrifice. I'd read a book about, making that made a recommendation to, dedicate half of your salary to other uh, kind of initiatives. And if I was going
Hmm.
half of my salary, that's a significant, I don't know,
Yeah.
contribution. I wanted to make sure that it was going to something worthwhile.
Yeah. No, thank you so much for that. Well, first, I want to say, um, your self-worth has been proven, I would say, a thousandfold. You are a very worthy individual in your contributions, in life. If you're just not counting personal with your children, your community, locally, and also now globally. It's been, what, the last 5 years, because KAFO has been founded in 2019 by you and Jules. You mentioned, looking at from a global perspective, the need is so much greater out there because, there are literally people who don't have shelter. Literally, they don't have food. They have to go searching for it. And um, yeah, there's definitely not a lot of help out there. And so I myself personally, I do think about that, and I've been thinking about it for a long time. But for me, because I feel like I can't go to, Africa and help, or Asia and help physically. So that's why I kind of retracted and also try to look back and do something locally from that perspective as well. And like you, if I heard of a charity in Africa, West Africa, I definitely would be a little bit skeptical, right? Like I would try to do my research, see where the money comes from, where it goes, um, so so I think for you, and then, personally knowing you and knowing that you dedicate, your funds, like your personal funds, so 100% really goes to charity. Like I can fully entrust that this is something I can get behind 100%. And it's also help with the fundraising and everything. Um, I just think it's great. And it also, I had spoken with Jules about like how it's certainly definitely something worthy looking at because the folks on the ground has really made it successful. Sometimes, you fundraise the money, and then it just disappears. You don't know where it goes. Like, once it gets there, like maybe there's corruption, there's administration fee or something like that. But really, the people there are so accountable. Um, I'm sure you have, if you don't mind, elaborating on that to some of our listeners here. Um, but they've really made it successful. They're the reasons for the buildings, right? Like there's a health center building, there's a primary school. This year, middle school was built. Clean water access, I believe that was in 2021. Um, just all these foundations that you can see physically, it's there. Uh, they have proof to show for it. So if you don't mind just talking a little bit more about that.
Yeah, no, that's really important. So this would never work if we didn't have really trusted colleagues in Concrona to just drive all of the changes, let us know what they need, and be accountable for everything that we're giving to them. And um, so we work most closely with Victorian, and he is brilliant. And so he has never gone to school, and yet somehow he has figured out how to read and do basic math, and he's a leader and people trust him, and he's obsessively accountable for every single penny that I send to him. And so I get constant updates on what he is doing. And it it was a little difficult in the beginning. We had this just very short list of things we wanted to do. We really just wanted to improve some of the elementary school scores, and maybe improve access to water just to make sure they had a clean source, and have a very small health post. But Victorian organized this amazing community association that quickly had hundreds of members. People are so excited when you just give them an opportunity to make improvements in their community. Then they were just so willing, and it came with an invitation to not only join, but you needed to pay every month. They pay it, it might be an equivalent to about $1 a month, but still it was significant for them. And so they join, and as soon as we started to build to help improve the elementary school, they came to us within weeks and said, this is really great, and we were very thankful, but we need housing for the teachers. And there was no way that was ever part of our vision. And so it was really important to have their feedback there. And so we did that right away. And now every education improvement that we create has with it the consideration that we need to have housing, even with healthcare. And so as soon as we had finished the housing for teachers, then they said, they really needed healthcare because it's too far. The whole thing,
Hmm.
those people never even left the village. And so to say there's a hospital, you have to somehow get a vehicle or walk 50 miles to it. People just didn't go. Like, they don't
Yeah.
walk 50 miles to get care. They just stay where they are, surrounded by the people they know and love, and they just accept that death is coming, even for, things that they
Yeah.
should not be dying from at, very early ages. And so they really wanted to see what they could do to bring that closer to them. And so, yeah, the input that we get from
Hmm.
the village is so critical.
And what Kathy is talking about is, like access, like you're talking about the health center, where people from other surrounding villages have to come. When they come, yeah, they may need to stay overnight because it's not as easy as coming and going here, where you can just drive home at night or take the bus home. Um, primarily the mode of transportation is really walking there. And Kathy, you mentioned something really important. You said that you seeked input from the community, and that really is the essence of public health. Is that first step is you can't just barge in and say you need this, you need that, but you guys really thought it carefully. you communicated, interacted with the community, asked them what they need, and you listened to them. And I think this couldn't have been a better collaboration. And I think you guys just did it just really perfectly, because you mentioned to me that you followed the UN model, um, with sustainability and all the access for development, with the UN development goals, and that hasn't seemed to steer you wrong, in the wrong way. Um, Only successful, but not in just one area, but feel like it's um, multi-pronged, multi-purpose, um, just in all aspects of human life. From if you're looking at from education, housing, healthcare, uh, clean water, and that translates to, preventing those waterborne illnesses. Um, so kudos to you and Jules, like just for really thinking it through in a thorough way. And honestly, I if I were to put myself in the foot of a villager there, I couldn't even imagine. I think it would just be an impossible thing to ever imagine that somebody would donate, you know, hundreds and thousands of dollars, not even their time, and just kindness into just helping out this village, right? Like from uh, not being developed because it's called the last mile, because it's the last place that developmental organizations would go into. Um, so it's amazing, and only hope that this can transpire and grow, and then maybe be that model for future villages to come, especially for Burkina Faso. So thank you. Um, could you talk a little bit about like your engagement? Did you feel like at any time there was pushback um, from village or members? I know you haven't had a chance to be there, even though you have traveled to Africa, but not necessarily this particular village. Um, but just some experience that you've had. I know a lot of it is positive. Was there um, any difficulties? Do you feel like there has been encountered at all?
Yeah, I mean, I guess overall, this is a system strengthening effort. And so it not without its difficulties. And, just thinking about the initial builder that we worked with. And so he had a lot of great ideas. He was extremely responsive and he came up with a really great vision for activities and projects that we could get into in the community. And we were really thankful to him for that. But the way that things are built now, I think very often, and this is the way a lot of government projects are run, it's just that there's money that comes in and the job is done, the task of building something is done, but there isn't a long term plan for making sure that whatever's built is maintained. And so we found that with some of the earlier construction projects, they looked fantastic, but over time there would be leaks or things wouldn't hold up as well. The batteries, we installed solar electricity everywhere. The batteries would not be working after
Hmm.
a couple of years. And so I don't specifically hold it against the builder. It's just that he's not, I guess he wasn't a true engineer. Like his official training was engineering, but what he really did was coordinate a random set of people that, did not work together routinely. And they delivered something that looked great on day one, but he didn't have a long-term relationship with them, and they don't live in the village. And so if things didn't work 2 or 3 years down the road, you know there just wasn't real accountability. And so it's taken us a bit. And so and it was a difficulty. I argued heavily with Jules, honestly, and the community when I started having suspicions about the sustainability of the work. And it was really tough to move because we had built up some trust with the builder that we were using, but
Mm,
I just I wanted more. I wanted to make sure, look, we're not going to be around forever,
yeah.
and I don't know how long this organization will last, but my hope is that they have an expectation from the very beginning that the quality of the work is better than what they normally might see with a government project or
Hmm.
external project. I want them to know that it can last. And I want them, because what happens now is, even in the health center, if the electricity goes out or the water stops working or
Hmm.
some of their equipment isn't working, then this is how they think these projects go. Then things just break down and then they're no good anymore. And
Yeah.
I we have had to really impress upon people that that's not acceptable. And so the people who are now paying in the community their dollar a month, or they pay small fees for things like water or healthcare, and the fees go to this whole maintenance and making sure it's not okay if the
Hmm.
electricity stops working or your equipment breaks and there are leaks in the roof. And so that might be what the standard was that they were used to, but we have to set a whole new standard and then, keep maintaining it. And so that part is tough.
Yeah, and like live and learn from the life experiences, right? And when you expect the best, people will show you their best. But yeah, it's honestly, do you think it's probably because they haven't there's not a lot of opportunities um, for experiences like this for builders, just because there hasn't been um, projects and funds devoted to villages, right? Like, so maybe there's that mindset as well, and it's also the beginning. So hopefully that builder will also learn from it and become better for his next project. Um,
Yeah, I hope so. I mean, I do think that that is a big part of it. That, I mean, this is what happens. This is how they did have a few classrooms in the community, but they were crumbling, and, there was never electricity from the beginning, and they always leaked. And so this is what people expect. And
mhm,
so one of the things that I'm doing this year. And so in 1 month, I've invited the village chief and the vice president, Victorian, who we've been working with from Concrona, and then also the first woman who was educated and earned a master's degree in the village to travel with me to Rwanda. Rwanda has an amazing program for development. They have a whole vision out to 2050, and it's very well documented. It's very clear, and it sets really great expectations for what good looks like. And so the entire country is working toward those goals. And so you can ask
mhm,
any of the citizens, they shut down the whole country once a month, and they all come together and they work toward this goal, and it's really beautiful to see. And so I wanted some of the people who had been born in Concrona and maybe not seen any other country that is doing it well to see what great looks like, so that they can have a higher expectation for what could reasonably be done to go ahead and support development efforts. And so I'm really hopeful that that gives them that sense and that we can really work towards that.
I That's a great opportunity, Kathy, and I think it's just so amazing. Um, I think you're a really resourceful person. Like, just even how were you able to find this program, right, in Rwanda? Um, Actually, tell us. Tell us how you found this program, because it's like, oh, thing, like, unless if you're somebody who is day in, day out working with these kinds of things, um, there's not a lot of knowledge, right? And then even for people who want to start something like this, or funding into money, and want to see results. Um, but yes, so just how if you don't mind, how did you find out about the program in Rwanda? Because that's amazing.
Yeah, it's in an unexpected way. So I do work in development of healthcare systems in uh, low and middle income countries primarily. And so then I was visiting Rwanda for that job. And um, while I was there, my flight got delayed for my trip home. And so I had one day to explore and try to see things a little bit. And so I didn't want to, I thought about just working in the hotel, but I wanted to get out a little bit. And this is just so, it's so weird. I don't know. It's hard to even say this because I honestly, ever since KAFO started, it's really hard to ever use money for frivolous things, and just because I know the money can go to something better. So I wanted to go to one of the national parks in Rwanda, and so I hired a driver through this, kind of very small shop in the hotel, and the driver was incredible. And so he was born in Rwanda about 2 weeks before their genocide started. And it was just a really horrible event that happened about 30 years ago in Rwanda. And then both of his parents were killed as soon as the genocide started. And so he was passionate about what was happening and the transformation that's going on in Rwanda.
Mhm,
So they're working really hard to recover from that whole event, even now, a generation later. And so, I mean, I think that's a lot of the incentive behind them working so hard to create better lives
mhm,
for everyone. And so, anyway, I did go to the national park. It was really interesting and everything, but none of it mattered to me, right? I mean, I guess when I was envisioning going there, I just thought I would see, wildlife in Africa, just check out the open savanna and see what it looked like, and it was amazing. But by far, the the more amazing part was talking to the guide. It was one of the most incredible experiences of my life. And what he talked about sounded so similar to what we're trying to
mhm,
do with CAFO. And so it was so neat to hear him describe just how successful all of these programs were. And so I've mentioned leaks. This is just one example, but I've mentioned leaks already. That a lot of the roofs of the earlier buildings that we started in CAFO did have leaks, and that was consistent with everything that was already in the village. But um, when we found a new builder a couple years ago, he had this different strategy for building roofs, and it was a very steep pitch, and he welded all of the connections and everything, and it's extremely effective, and there are no leaks, and he gets rid of a lot of the screws and everything because it's all metal roofs and everything. And so then when I was in Rwanda, I could see that a lot of the newer building had the very same roof. And
wa
so then
wow.
it was just one thing that stood out to me, like they are doing it. And so
Yeah,
great that, we figured it out kind of by accident, but
yeah,
what else was there that we could learn from that?
mhm.
It's,
Amazing, amazing. So you never know, right? When you actually put yourself out there, go on an adventure, find that driver, you would have not been able to find this program without just trying to explore the city. So did the driver give you information to contact the program leads in Rwanda, or did you just kind of get the name from it and then did some search yourself?
Yeah, so it was as I was going through this, I started to think I really want to bring some people from Burkina Faso here. I contacted the driver afterwards to just see what he would think, and because he lived in a village of maybe 500 people or something, so it's much smaller than Concordia.
Hmm.
But I just asked what he would think of setting something up that could allow the village leaders from Concrona to meet with his village leaders and then their regional representatives and everything. And so he put me in touch. There's unbelievably a government program for partnership, and so then he found that for me. And so then we are going through an official government. It's called a study tour. Then that their partnership division is going to go ahead and lead a 3-day session with us.
So the moral here, it sounds like to me, is don't judge book by its cover. Don't judge a person's capacity or what they're capable by what they do, right? This driver was able to be that connector for you, to get, you know, uh, connections with Rwanda folks and government, and that's just amazing. I have similar experiences, not to the extent that you do. Just when I go and I volunteer meal serving in Philadelphia, um, just be amazed by the people that you meet who are willing to go out there and do the same service as well. Um, a lot of them do have the same passion. That's why they're there. But you never know, what they do or how you can actually connect and converge people. So really, that's kind of the experience that I've been experiencing lately. Is that I find all these different folks from different sectors. And then it just kind of like pops in my head, like, oh, let me just connect this person with that person because they're really doing the same thing, finding common ground and um, seeing how we can work together. I think that's where you see the best and it just makes the efforts a lot easier. And also, another thing is so you don't feel like you're doing it alone, right? Because sometimes we're so isolated that we feel like we're just doing this by ourselves. So it's a great feeling to see other people doing the same thing. Um, so thank you so much, Kathy. That that is amazing. And you know, this is Kathy's passion, Kathy's work. Currently, what you're doing for those who want to pursue something similar, Kathy, to what you do, what would you recommend for them as far as like pursuing in college, or even just tell us what your major was in college, um, and your role. Like currently, it's in regulatory affairs, right?
Yeah, that's right. So I have an undergraduate degree in biology, which I don't know would be sufficient to qualify me for the job I have now. I think it was more the experiences that I gained since then. But so I think what is most important is to really follow your passions. And so before I ever went to college, I had this idea that I really wanted to help as many people as possible. And so, initially I thought it would be through, maybe becoming a physician. And I just financially, it was such a challenge to get through college that I was eager to, pay off student loans and not get into any more debt. And so I didn't go all the way through medical school, but still was very interested in public health. And so that just started a career in healthcare, just in the pharmaceutical industry. And there were just so many different decisions that I made that would lead me toward this whole vision of helping as many people as possible. And so I think it's really important for other people you can start anywhere. And I can now realize I work with many physicians and other healthcare providers. And I think we're all coming together in the same place because we have the same passion to help people. And so no matter what your maybe educational level is, you can figure out how to have an impact. And so if you're following what you are most interested in, and I know that people so often try to figure out what job they could have that's going to make them the most money, but I don't think that I don't think that's as important. And it's easy
Hmm.
to say, right? Because I'm on the second half of my career for sure. But I don't know. I think I think you can do both. I think you can follow
Yeah.
something that you're passionate about and bring all of your skills together and have a really meaningful life and be doing what you love and
Hmm.
helping as many people as possible. It can all come together.
Absolutely. And I think what you said, like just follow your passion. Sometimes when you first graduate from high school, going into college, you may think that's your passion, but really a lot of us haven't had a chance to be exposed to a lot of things in life to truly find our passion. So I think that would be a really good thing is just to try to see what you like. What is it that you like doing? Because I have a cousin who, point blank told me when she was about to graduate from high school, because I had mentioned, something in healthcare, if you want to help people. But she said, I don't want to help people. That's not my passion. Because you can kind of relate helping people to a lot of things, right? It doesn't have to be healthcare. It could be like helping them with their financials or something like that. But point like, I don't want to help people. Okay, all right. So what is it that you want to do? Um, so yeah, I think she followed her passion maybe in pursuing her goal. Not sure about the happiness, but I think passion is what makes you happy at the end of the day. Do you enjoy doing it, right? It's it's you don't need to go into that typical I have to be a doctor or a lawyer um, to make lots of money. Because Kathy, you and I can probably attest that a lot of people that we work with um, don't have those degrees. They could either have an MPH, MBA, bachelor's. I really think it's just how you interact with people in life and how you have your work experiences and how you're able to have, I want to say also a portion of street smarts too. Like, you have to be able to apply what you learned into your role as well. Um, so yeah, so I could say I'm 40, and I still don't know what I want to do, but I do know that it has to be related to public health for me to be happy. Um, so yeah, so I think just figuring out what you want to do is a never ending life purpose. Um, but just the fact that we have, the opportunity to try to figure it out, that's amazing in itself because not a lot of people have that opportunity. So, you know, if you do have it, please take it, think about it, grasp it, um, pursue what makes you happy, guys. Uh, any last remarks, Kathy?
I mean, I think just that there are so many opportunities that are available to us, and I think the more we say yes to, the closer and closer we can get to going in the direction that really fulfills what we see as being purposeful. And so you had this vision of public health, and so I think the more you experience or opportunities that come up in your life that can get you closer to greater public health, I think it just makes for a really more meaningful life. And so it's really
Yeah, yeah, no, absolutely. And the more you say yes to, the more you'll find out what you don't like,
true.
and where to stay away from. Because I've also heard from a lot of public health people not enjoying their jobs, right? And maybe it's because they don't have the autonomy to do certain things that they would want to do. So yeah, keep saying yes and see what you like, what you don't like, and then just keep chugging along. So guys, thank you so much for spending the last almost close to 40 minutes with us. And until next time, we'll have something else better to talk about. Anything you want to talk about, just put it in the comment. Let us know how you feel, guys. Connect with us and we'll try to reply to you. All right. Bye, everybody.